Good morning, everyone, and thank you for joining us. We will begin today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. We will also be hearing from Dr. James Hildreth, President and CEO of Meharry Medical College, followed by Dr. Loida Williamson, Chair of the Department of Psychiatry and Behavioral Sciences at Meharry Medical College. Dr. Michael Caldwell, Metro's Public Health Director, and Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning. I want to thank everyone in Davidson County for observing the Safer at Home order, which took effect yesterday. And because we know that a coordinated response is an effective response, I'm encouraged to see similar actions taken yesterday in cities such as Memphis, Knoxville, Chattanooga, and counties such as Sumner. By remaining at home, practicing social distancing, and limiting all non-essential gatherings of no more than 10 people, you are helping to flatten the curve of the coronavirus in Nashville. You are truly safer at home. And together, we are helping our dedicated healthcare providers. Now, non-essential businesses throughout Davidson County remain closed until the Safer at Home order is filled over the next 2 weeks. Grocery stores, banks, hospitals, pharmacies, and other essential businesses and institutions remain open. So I encourage everyone to shop for their weekly groceries as you normally would, and feel free to place a curbside pickup or delivery order to support your favorite local restaurant. But otherwise, remain comfortably at home to safeguard your health. The Safer at Home order is for everyone, including our unhoused and unsheltered neighbors in Davidson County, who are among our most vulnerable residents. We already have 9 public hand washing stations deployed around the community for our homeless neighbors, and we are working with our community partners to establish safe accommodations that allow for proper social distancing while also connecting homeless individuals with important social services. We have a goal to launch this emergency shelter on Thursday of this week, and we'll announce more details as they become available. We worked closely with regional hospitals and healthcare partners to develop Safer at Home. And I want to thank Dr. James Hildreth, President and CEO of Meharry Medical College, for joining us again this morning to provide greater insight into the COVID-19 and what each of us can do to keep our families safe. In addition to his leadership role at Meharry, Dr. Hildreth brings decades of infectious disease expertise to this discussion. Epidemiologists and public health professionals, both here and in Nashville and around the world, have advised us that we are, in fact, safer at home. We can mitigate the spread of the coronavirus by socially distancing ourselves as best we can. But the fact is, some of our neighbors are not safe in their own homes. Domestic violence through assault, intimidation, and abusive behavior is all too real for some Davidson County residents, and it should never be tolerated. Of course, if you're experiencing this emergency, you should always call 911. But the YWCA's Domestic Violence Crisis and Support text line is also available 24/7. You can get help without speaking a word by texting 615-983-5170. Now, I want to thank Dr. Loida Williamson from Meharry Medical College for joining us this morning to help Nashvillians who ever find themselves in a domestic violence situation learn ways to find help and support. Dr. Williamson will also discuss ways that Nashvillians can cope with the mental and emotional challenges that can accompany social isolation. She will discuss community resources for anyone seeking mental health support at this time. Now, the Office of Emergency Management and our Department of Public Health has moved swiftly in collaboration with our healthcare partners to set up several community assessment centers across Davidson County, two of which have already been constructed, one at Nissan Stadium and the other at a former Kmart site on Murfreesboro Road. These assessment centers are ready to open and serve the public. But, like other cities around the country, a delay in the supply of test kits has prevented our opening these sites. We will be operational as soon as those resources are in place. I'm grateful to Governor Lee for creating the state's COVID-19 Unified Command yesterday and appointing Stuart McWhirter to lead this coordinated effort among Tennessee Emergency Management Agency, the Tennessee Department of Health, and the Tennessee Department of Military, speeding up our ability to obtain these needed medical supplies. I also want to thank Vice Mayor Schulman and the Metro Small Business Task Force that will be announced this morning. Councilman Steve Glover will co-chair this effort to find ways to aid and assist the many small businesses affected by the coronavirus and by the tornado. Our local businesses are the backbone of our community, and we remain focused on getting Nashville healthy and back to business as usual. I'd also like to remind everyone who has the means to do so to visit covid19.nashville.gov and contribute to the COVID-19 Response Fund, which was created with the help of the United Way of Greater Nashville to support Nashvillians facing hardships during this time. And now, for our daily briefing, I will turn it over to Dr. Jahangir, Chair of the Metro Coronavirus Task Force. Thank you very much.
Thank you, Mary Cooper, and good morning. Let me start with an update on the coronavirus in Nashville. As of this morning, we have had a total of 253 confirmed cases with a total of 1 confirmed fatality. That's an increase of 69 cases in the past 24 hours. Now, as I said yesterday, I do not believe the trend is going down, and the number of cases most likely will continue to increase in the coming days. The patients range in age from 11 to 73 years old. Of the confirmed cases, 4 are currently hospitalized. 219 cases are self-isolating at home and have mild and manageable symptoms. 29 people who were confirmed cases have recovered and are now cleared. A top concern for Mayor Cooper is the health and safety of our homeless population. They are among our most vulnerable. They gather in large numbers and sleep in close quarters, increasing the threat that they will get sick. I'm happy to let you know that today we are taking action to assist them through this pandemic. We have been working with several of our nonprofit partners and have a plan to use several Metro facilities to provide shelter for the homeless. We have facilities for unhoused individuals to practice social distancing in line with best practices. In addition, we will have a separate facility where people can self-isolate safely while awaiting test results. Finally, we will have a facility for those who have tested positive for COVID-19 but do not need to be hospitalized, but will need to be self-isolated while recovering. We have seen the homeless populations in other cities hit hard with this virus. We cannot have this happen here in Nashville. Along with our nonprofit partners, we'll be providing a space for those who need to be safe and who don't have a home. We're finalizing the logistics and staffing, and we'll open these facilities very soon. Starting tomorrow, we will launch the COVID-19 Information Hotline. This will be staffed by healthcare professionals at the Metropolitan Department of Health. Nurses will be available to assist residents of Davidson County who may have questions about COVID-19. They will assist those who want to know if they need to be further assessed, and if so, direct the caller to resources that could assist them further. We'll post the details of the hotline on our website, covid19.nashville.gov, as well as on social media. We have been working tirelessly to open the community assessment centers. Several have already been constructed, and there are plans for many and for several more. But as the mayor said, we're not ready to open them just this second. And there's one reason. Simply put, we need protective equipment and testing supplies. And when we get them, we will open. We continue to work with our state and federal partners, as well as our private sector, on securing the supplies we need. And this is where you can help us as well. We're calling on healthcare facilities and professionals to donate personal protective equipment and other supplies that they are not currently using. Go to our website, covid19.nashville.gov, to see what is needed and let us know what you can donate. If you have smaller amounts of supplies, please bring them to the Community Resource Center on Omohundro Place, and you can drop those off on between Monday and Saturday from 10 a.m. to 4 p.m. We face a potentially shortage of this critical equipment and supplies, and we need your help to get what we need to keep our healthcare workers and our first responders safe. As I had mentioned before, these community assessment centers have always been meant to serve as an addition to the robust healthcare system in Nashville, a healthcare system that is strong and currently responding to the needs of our community. Although our assessment centers have not opened yet, I want to reassure the people of Nashville that if you need to be assessed, you can be by contacting your healthcare provider. And finally, we have been under the Safer at Home order for just a little over 24 hours now. Thank you to the thousands of Nashvillians and the many businesses who are complying with this order. But I want to reemphasize this fact. Only leave your home if it is absolutely necessary. Before going out, ask yourself, is this trip essential? If it isn't, then please stay at home. As Dr. Hildreth and other experts have told us, the best way to combat this virus is for you to stay at home. Do this for your community. Do this for the first responders and healthcare workers who are out there saving lives. Do this for your family and friends. But most importantly, do it for yourself. It is the best way to protect yourself from this virus. Remember, we may be apart, but we are all in this together. And together, we will make a difference. Thank you for your attention. And I would like to now introduce Dr. James Hildreth, President and CEO of Meharry Medical College.
Good morning, Nashville. I wanted to provide some further scientific context for the COVID-19 response as we are engaged in currently. And I thought I might share some thoughts from some other pandemics that we've had to deal with over the last few decades. The HIV pandemic first arose in 1981, and one of the things that happened at that time was that we felt, or people felt, that this virus only infected gay white men, and that was clearly not the case. From the very beginning, the virus was infecting heterosexual and gay persons, men and women, African American, Hispanic, and white. But that myth took hold and caused a considerable delay in research and developing a national strategy to deal with it. So one of the important lessons that we need to take from that pandemic is how important it is to deal with facts and scientific data when we make our decisions. In the case of COVID-19, there are still those who believe that the virus only affects those who are elderly or have underlying conditions. That's clearly not the case from data from other countries. And as you've heard, here in Nashville, the youngest person that's infected with the virus is 11 years old. So clearly that is a myth that needs to be dispelled and done away with. There's been a lot of discussions about the outbreaks in other countries, comparing those outbreaks to those in the United States here with us. There are some important factors I'd like to illustrate for you that make it important. There are lessons we can learn by doing this. For example, in China, one of the observations that's very interesting is that men are much more likely to get infected, to get really sick, and to die from COVID-19 compared to women. This can probably be explained by behavior and by physiology. Behavior-wise, men all over the world, it's a fact, practice hygiene in a different way, or less meticulous, let's say, than women. And of course, hygiene is an important factor when you're dealing with this virus. The other one is physiology related to the immune system. It's been well established for a long time that women appear to have a stronger immune system than men do. This may be because there are important genes related to the immune system found on the X chromosome. And as you know, women have 2 copies of the X chromosome. Men only have 1 copy. That means that proportionally, women probably have more proteins related to some important immune functions compared to men. But it is clear that there is a disparity in the rate of infection from men and women in China, a very large disparity. And consider this, over half of the men in China smoke compared to less than 3% of the women. And we know that smoking causes changes in the lungs that predispose disease when we get infected by almost any virus. And here in the United States, one of the things that concerns me is teenagers, as you know, have been vaping in large numbers over the last few years. And you might recall that some of the teenagers who vaped got such severe lung disease they had to be hospitalized and treated with a ventilator. So that means that here in this country, we might expect, and there's every reason to expect, that if those teenagers, young people, got infected by this virus, they may get severe lung disease. So that is another factor we need to be aware of. The other thing that I made a point of in my previous conversation with you is that almost anything that compromises the immune system is going to impact the way that our bodies deal with COVID-19. And there are some important conditions that impact the lungs that will do the same. Here in the United States, we still have a large number of people who smoke, and those smokers are known to have changes in their lungs that are going to predispose to disease. So we have to put smokers into the high-risk category. There's also asthma. More than 25 million people here in the United States suffer from asthma. And the pathophysiology of asthma is such that the lungs become inflamed, they get infiltrated with cells from the immune system, and that will compromise their ability to breathe. And importantly, many people with asthma are treated with drugs that suppress the immune system. So in the case of asthma, we have two things working against us when it comes to COVID-19. Our lungs are already compromised. We're being treated with drugs that suppress the immune system, making asthma another risk factor for severe disease. And as I said, there are over 25 million Americans who suffer from asthma. The other one I'd like to point out is obesity. Compared to many other countries, the number of Americans who are obese, as you know, is quite a bit higher than other places. And what you may not know is that obesity itself can compromise our ability to breathe, the function of our lungs. For one thing, the muscles that are responsible for expanding and contracting the lungs become compromised in people who are obese. So imagine getting a virus that further compromises our ability to breathe in COVID-19, and you can see that obesity may well be another factor that makes the disease in the United States very different than it is in other countries. The other thing is I'd like to provide another perspective on the Safer at Home strategy. I need to talk about something called vectors. Viruses are incomplete life forms with no ability to replicate on their own, so they must find a way to gain entry into the cells in our bodies. And many viruses need hosts before they can jump into our bodies, and those hosts are called vectors. A great example is a parasite that causes malaria. The vector for malaria is mosquitoes. Without getting into mosquitoes, malaria cannot get into our bodies because it's in the blood. The mosquito bites a person, takes up a little bit of blood that has malarial parasites in it, and deposits that into the next person by a microtransfusion when they bite the next person. So in the case of malaria, mosquitoes are the vector. And one of the things that's being done is to literally make the mosquito responsible for malaria extinct. And there's a study in which they're going to try to make the mosquitoes infertile so they'll disappear. In other words, they're trying to eradicate the vector for malaria. Avian flu is another well-known pathogenic virus, pandemic virus that we've been dealing with. And it's one of the most concerning pathogens because it has a 50% fatality rate. That is to say, half of the people who get infected by this flu virus, they die. Thankfully for us, there is no direct human-to-human transmission. We can only get the virus by interacting with the birds that carry the virus. And one of the latest outbreaks, 200 million birds were slaughtered in an attempt to eradicate the outbreak in this particular location. So they eradicated the vector to keep humans protected. Now, in the case of coronaviruses, their normal host are bats. And bats or humans are so genetically distinct that viruses that infect bats cannot infect humans. So there is a requirement for an intermediate host. For SARS in 2002, it was cats. For MERS in 2012, it was camels. And what happens is the virus gets into the intermediate host, adapts to grow in mammals, and then it's able to infect humans. So in the case of SARS, the vector was cats. In the case of MERS, the vector was camels. The difference with COVID-19 is we are the vector, because now that the virus has jumped into humans, it's able to jump from human to human. So in the case of coronavirus that causes COVID-19, we are the vector. So our challenge is to do what was done in the other cases to eradicate the vector. So what we're asking you to do, maybe this can be a hashtag, don't be a vector for COVID-19. Nashville, I'm pleading with you, don't be a vector. And you don't become a vector by staying safe at home, social distancing, sanitizing surfaces often. And if we do that, Nashville, we can defeat this virus. Please, Nashville, don't be a vector. And with that, I'd like to introduce Dr. Lorda Williamson, who is the professor and chair of psychiatry and behavioral sciences at Meharry Medical College.
Good morning, Nashvillians. I'm pleased to be here to share some encouragement and some guidelines as we're seeking to deal with the stress and anxiety as we deal with COVID-19. It's impacting each and every one of us, from children to the older individuals. And one of the things we have are concerns that are out of our control. So it's important for us to focus on things that we do have control of. One of the things we can do are adopt healthy habits that will help us as we work towards emotional wellness. Some of these healthy habits include choosing to have a regular routine, choosing to have regular sleep habits, choosing to eat a large portion of fruits and vegetables in our regular diet, and of course, drinking lots of water, staying hydrated. Choosing to have regular physical activity. That can be walking outside, it can be walking inside, it can be moving in place as you sit or just move on your daily routine. Choosing to breathe deeply and relax, calm your nerves down, calm your respirations down, calm your heart rate down as we think about the different news items that come across the different media. And of course, choose to limit, and I stress, choose to limit the amount of news that we watch, that we listen to. We don't have to listen to every single news story or read every news bite that comes across social media. So these healthy habits can help us as we seek to adjust to a normal routine or establish a new normal. One of the things we do know is that accumulative stress makes a difference. For Nashvillians, we were already dealing with normal stressors of daily life, with coming and going, dropping people to different appointments, working, school routines, and then we had the tornado. Before we could recover from the tornado, we're now dealing with the coronavirus. And all of these stressors pile on little by little and make our anxiety more prominent. Many times we're feeling powerless, we're feeling that things are out of our control. So it's very important to pay attention to our internal state of mind. And again, we can make a choice to think about things in a positive way and think about things that will make us make good choices. As we monitor our internal emotional and mental state, we must be aware that some people may be experiencing more serious emotional and mental illnesses. How do we know that? We would know that if we have more difficulty in our daily routine in terms of concentrating, sleeping, if we are still working as healthcare providers, if we are unable to engage with our family members and interact with them in a calm and peaceful manner while we are at home. None of us are immune to depression and anxiety. Every one of us has a breaking point according to the stressors that we've experienced in the past and the stressors that we are dealing with now. According to the Centers of Disease Control, 50% of Americans, of all Americans, will be diagnosed with a mental illness or disorder throughout their lifetime. That's a significant amount of our population. Now, let me just remind you, these are not character problems that I'm talking about. These are medical problems, just as we might have problems with our lung or our stomachs, for example. Our brain is an important part of our body. So if you are experiencing some of these more serious difficulties, think about ways to cope by letting people around you know that you're under a lot of stress. There are some community resources that can provide support, and our mayor mentioned if you're in a particularly difficult or challenging situation while you're at home and more contained in an environment and interacting with people perhaps that you may not normally have interacted with on a long period of time, experiencing domestic violence, physical abuse, or even sexual abuse, you can call or text the domestic violence hotline. And that number again is 615-983-5170. If other individuals are experiencing crises in terms of a mental health crisis, emotional stress, there is help available through the Tennessee statewide crisis hotline. And that number is 855-CRISIS or 855-274-7471. We must take care of each other. So use your media to reach out and talk to people on the phone, text, Skype, your loved ones. Reach out to your community of faith for strength and support, for a sense of purpose during these uncertain times. We are all in this together, and as we look for a sense of peace and calmness, let me just remind you about our serenity prayer. God, grant us the serenity to accept the things we cannot change, courage to change the things that we can, and the wisdom to know the difference. Thank you.
Thank you, Dr. Williamson. Thank you, everyone. We have time for just two questions. We will start with Tosin Fakile at the WSMV. Tosin.
Hi, thank you, Chris. This is Tosin with News 4. Two questions. One, when will these homeless shelters be open? Because I think I heard the mayor say later on this week, but I wasn't necessarily clear on that. And the second question is, so a lot of people have been talking to me about rent and stuff like that. So is there anything being done to help folks pay their rent later? Are they talking to landlords? Anything of that sort to kind of help in that financial situation?
I'll have Dr. Jungier come up here and talk to you about the homeless shelters.
Thank you. As I mentioned in my remarks, the homeless shelters and making sure protecting our homeless populations is a vital priority to the mayor. It is our intention to work as hard as we can to get the plan we described out by later this week, and I hope that is by later this week. We're just figuring out some final logistics today, and we'll hopefully be able to announce a start date very soon. Regarding rent and so forth, I know that we're working with MDHA and other places to find a way that we can help our citizens that need help with rent. I do ask that if you're a landlord, that if you can give people some understanding of grace, that would be very helpful. So thank you.
And Ian Jong at the Tennessean.
Thanks all for doing this briefing. I wanted to ask about their interview about what they think about President Trump signaling that he might ease some of the restrictions much sooner than what health experts are advising might be necessary and before we see a decrease in cases. And as part of that question, do you imagine that would change anything on how Metro might be approaching all of this?
Dr. Jung.
Thank you so much for the question. You know, we believe that flattening the curve is critical. As Dr. Hilder has mentioned, we are the vector, and I think flattening the curve is critical. And the science has shown, and best practice have shown, that social distancing, safer at home initiatives that's the way this has been solved in places overseas and other communities around our country. So we believe that our Safer Home Plan is the right way to go, and we'll let science and best practices continue driving our decisions. Thank you.
That's all the time we have for questions this morning. We'll have a recording of the broadcast that will be made available later today. Thank you for joining us, everyone. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.net.